So my name is Julie Shevlin. I'm one of the board members for Cure JM, and just want to welcome you to our first session today. This afternoon, we have 3 different sessions that are leading up to our welcome session that'll be starting at 6 o'clock tonight. This afternoon was really just focused on connecting and supporting each other and getting to meet each other. Tomorrow will be more focused on the medical part. So just want to welcome you. Restrooms are just near the elevator around the corner that way. We are here for an hour and a half from 1 to 2:30. We want it to be a very comfortable and welcoming and casual environment. So if you need to come and go for your own reasons or your children, grab water, go to the restroom, please come and go as you feel you need to. And we're led by Jennifer Cara, who is president of the Dallas chapter, and Michelle Best, who's president of the DC chapter. And I'm going to let them take it.
Hello. The first thing is we're going to be videotaping. So, and there'll be some participation from you all, hopefully. So if you're not comfortable with being videotaped, if you could let us know beforehand, that would be helpful. And they'll just do audio. Is that correct? Yes. So if anyone's not comfortable. Okay. All righty. So shall we start? Yes. Okay. Do we do this first part? Yeah. Okay. So for introductions, what we thought we would do is, so you can kind of get to share your stories and get to know each other. You're going to find a partner, and you're going to take 2 minutes sharing your JM story. And so you'll have 2 minutes to share with your partner, and your partner will have 2 minutes to share with you. And then we'll come sit down, and what we would like you to do is introduce your partner. So you will need to know their name, where they're from, JMer's name, age, and age of diagnosis. Okay? So that's...
You don't already know.
Yes. So... I can grab my phone too.
Okay, we're going to come back together now, and I'm going to model for you. My name is Michelle. This is Jenny. Jenny is from the Dallas-Fort Worth area. Her daughter, Maddie, is currently 13, and she was diagnosed when she was 7.
This is Michelle. She's from Arlington, right down the street. Her son is James, who was diagnosed right before he turned 4, and he is currently 14.
Hello, I am Susie, and this is Josette. Her daughter Gia is 16. She was diagnosed at age 2, and they live in Maryland.
Hi, I'm Josette. This is Susie. She lives in California. Her daughter's name is Miel. Sorry, it's very pretty. She's also 16 like my daughter, and she was diagnosed at 5.
Okay. Do I do my partner or me first? Okay. My name is Sandy, and my daughter's name is Hannah. She was diagnosed at... I'm just... Okay. Okay. So... my partner's name is Kate. Her daughter is Chloe. She's 23, and she was diagnosed at 7. They're from New Jersey.
So I'm Kate, and I got to know Sandy, who's from Boston, and she's here with her daughter Hannah, who's 15, and she was diagnosed when she was 5. And it's interesting that both of us are here for the first time at one of these conferences, and we're really here because our daughters found out about it, and we're the movers who said, let's go to this conference, Mom. So.
Good for them. Well, my daughter went to find out, now going into second year of high school. What do I do because they're having an insurance second? And I'm going into driver's ed, and I'm an athlete, musician, and I want to know how about college. What do I do?
will not address all of that here,
No.
but some of it will have.
I think some people here may have experiences.
Hi, I'm Mary Ann, and this is Amy back here. And her daughter was recent. His name is Abigail. They're from Yarmouth, Maine, and she was recently diagnosed at age 12. So they're kind of new to the experience, and I think it's a great place for them to learn about it with a lot of supportive people.
Hi, I'm Amy. This is Mary Ann. Mary Ann's from Long Island. Her son Robert is currently 25. He was diagnosed at 15 years of age, and already with our brief conversation, she's already given me some really good information. So that's exactly why we're here. So, thank you. Oh.
Hi, my name's Carrie. This is Nancy right here. Her daughter is Noelle, who is currently 20 and was diagnosed at the age of 10. And they came all the way from Long Island. Mm-hmm.
I know you're from Long Island too. Is that what you said? Somebody is, right? Yeah. Oh, you're Long Island too? Okay. My name is Nancy. This is Carrie. Her daughter Bryn is 11. She was diagnosed at 5, and she's from Detroit, Michigan. Well, near Detroit.
Hi, my name is Doreen. This is Stephanie. Our son's name is Parrish. He was diagnosed at 15. He's now 18 and he's going to college next year. Have you done my phone somewhere?
No, anyway. I have many children, so I do not need a microphone.
So this is Doreen. She's from Long Island. Her daughter Maddie is now 15, was diagnosed at 7.
Hi, I'm Corey. This is Stephanie. She's from Detroit. Her daughter Sarah is 16 and she was diagnosed at 13.
Hi, I'm Stephanie. This is Corey next to me over here. They're from Ohio, and she has a daughter, Chloe, that was diagnosed at 15, and she's 17 now.
Hello, I'm Catherine, and to my left is Jane from Memphis, Tennessee. Her son, Landon, who is 13 now, was diagnosed when he was 6 and is currently in remission. After only 2 years of treatment, he's been in remission since. So I think that's pretty awesome.
Well, hello, it's my pleasure to introduce Catherine. Catherine is an international visitor from Nova Scotia, Canada. And her son Liam, currently age 14, was misdiagnosed, as probably many of our children were at one point, at age 13. And this is her first conference, so welcome.
Hi, I'm Danielle, and this is Angela in front of me. She's from Indianapolis, Indiana, and her son Jameson was diagnosed at age 9. He is now 10, almost 11. So
that's what I'm in from Indianapolis. Oh, okay. Okay, excellent. All right. This is Danielle. She is from Fort Worth, Texas. Her daughter is Chloe. She's 12 and she was diagnosed at 3.
So my name is Rondalyn, and this is Chris, and Chris is from Maryland. Her daughter is Maddie. Her daughter Maddie is currently 18 and was diagnosed at 17.
Hi, I'm Chris. This is Rondalyn. She's from Houston, Texas. Her daughter is Hannah, is 17, and she was just diagnosed in August last year at 16.
There's a couple people who missed.
Hi, I'm Debbie. I'm from New York. My daughter Heather, my youngest child, is now 12, and she was diagnosed when she was 9.
Okay, we're going to talk a little bit about what happens when you are a teen or a tween, and I know a little bit less or maybe a lot less about a young adult because that hasn't happened to me yet in terms of parenting. But what happens to your typical tween or teen is they're suddenly becoming self-aware. They've moved on from being just one of the kids where they get moved from place to place to place, and they are suddenly aware of who they are and what's going on around them. And they're paying more attention to the fact that maybe what they look like, maybe I'm different from the people around me. And at the same time, they're also working on their independence. Now we can throw in JM, whether it's something new that hits during this time or whether it's something that they've been living with for years. Having JM or any other type of medical condition really puts a wrench in things. So one of the things we want to do is kind of keep those kinds of things in mind, is that our kids are really struggling, especially our kids, and they're trying to become independent. They're trying to become not part of, they see themselves when they're younger as part of mom and part of family. That's who I am. And as they hit those years where they become independent and they see themselves as part of something else, then now they're dependent on mom all over again, because mom has to take me to all the doctors. Mom knows what medications I take. Mom or dad, but in our case, mom. Mom is the one who is making sure that I have sunscreen on and all of those things. And what are our kids doing? How many of your kids fight that? Anybody's kids fight that? So please know that as your kids are fighting that, it is a normal biological thing going on in their lives. And it is complicated by the fact that they are forced to do this in order to be healthy. So there's a lot of turmoil going on anyway. And then we have added this piece. So we just wanted to kind of throw that out as a start in terms of understanding our kids as we go through these pieces. The other piece that I didn't mention so much, but when they hit this time, less about mom and dad, more about being like their peers. We find them making some different decisions. They don't want to be different than their peers. Their peers are all going out and having lunch on the picnic table outside in the sun. That's not a good choice for our kids. Where do they want to be? I mean, so it is just kind of a constant struggle for them to make wise decisions and balance things. Sometimes you need to go do what you've got to do. Sometimes you really need to make sure that you're staying healthy. So working with our kids in there. So I'm going to start out. We've decided to change up the format a little bit this year. If you guys, I don't know, sure, how many of you have been to a conference before? Okay, so some of you guys will notice we're formatting this a little bit differently this year. We've decided to come up with some topics. And what we're going to do with these topics is we're going to have you guys tell us. So these are some of the hot topics that that have brought to our attention. So one of the common questions we often see are, what are the medications our kids are taking? What are they doing to our kids? What do we need to know about these medications? So we're not doctors, so we're not going to be talking about the medical aspect of that, but we will be talking about and actually, it's not us talking about it either. You guys will be telling us. This microphone's going to be flying around the room. You guys are going to be telling us, and we're going to be writing down what you tell us. So what are some common medications that our kids are taking? Prednisone. Methotrexate. Plaquenil. Cellcept. IVIG. What? Gamagard IVIG, yes. Rituximab. Bactrim, okay. Plaquenil, rituximab, cyclosporin, okay, cyclosporin. Exactly. The Zofran, the Prevacid that our kids take, yours takes zinc. And so these are all our, so we have, okay, rituximab is one that was mentioned. Rituxan or rituximab?
Sorry, we're doing lots of abbreviations.
Have we pretty much covered what your kids, there's Orencia is out there. Cytoxin. CYTOX. Vitamin supplements. Okay. So let's start with the prednisone. What are the side effects of prednisone? Moon face, Rage, exactly. Rage. Diabetes, is that what you said? Cataracts. High blood pressure. I'm over here. Bone issues, yes. Weight gain. I didn't hear what you said. Oh, okay. Eye issues. Stunts growth, exactly. Excessive hair growth. Yes, yes, stretch marks. Yes, it can cause stretch marks. Sleep disturbance, exactly. So what do you guys... yeah, absolutely, it can cause anxiety. Memory, but brain fog is... There's different schools. It may be prednisone, it may be methotrexate. So I think that some of that comes from pretty much anything that some of these heavier medications. Okay, I think, let's go on to methotrexate. Side effects of methotrexate, what have you guys noticed? Nausea, yes. Anything else? Hair loss? Wait, what? Oh, the liver enzymes. Yes, liver enzymes. Fascinating. Interesting. Isn't it amazing how these medications are different for each one of our kids and they have different experiences? So if your kid is having an experience that nobody else's kid seems to be having, that doesn't mean that your kid is not having that experience. Keep that in mind and make sure that you don't let the doctors tell you that they're not having that experience. They may not understand why, but if it's happening, it's happening. Right. So that's what we're here for. Is we're going to discuss different solutions. We're going to discuss solutions.
I think one of the other things that the pregnancy causes is loss of taste.
I agree with you. I think we experienced that. We experienced a change of taste for my son, and he actually lost weight on prednisone, and he would not eat until he did not start eating normally and growing until he went off prednisone. And yes, no, you are not the only one. Anybody else in here have their child lose weight on prednisone? 3 of us. See, it's not, do you see, but in a room, there's 3 of us in here. So that's not a small percentage of the room. It's strange. There's no, you got to keep in mind, we're putting together a specific chemical medication that our kids are taking, and we're mixing it with our children. And our children are all different in the way they process medications and metabolize and everything. So it's going to play out a little bit differently for everyone. Yes, they are. So then you never really know what it is. Okay, I want to go on to CellCept. Talk to me. Oh.
Yeah, we're just
methotrexate.
So we're kind of a little.
Brain fog is a big one from methotrexate, and there was another one I was trying to think of. Okay, so mouth sores. Thank you. Methotrexate. That's another big one.
We had headache for that too.
And headache under methotrexate?
Also for methotrexate, it's a large amount of hair loss.
Okay. How about CellCept?
Mine has trouble going to the bathroom.
Constipation or, okay, constipation. No problem with CellCept? No? Great. Fabulous. Anybody else have experience with CellCept?
I don't have experience with salsa, but methotrexate also causes joint.
Okay, put it down. Okay, back to. Interesting, because I hear a lot about stomach issues with CellCept. So we have a room full of, there you go, we have, okay, so there are some stomach issues. And basically stomach upset. I'm not going to say it's nausea, but just stomach upset that has not helped with compliance and taking the medication. Okay, IVIG, side effects, headaches, nausea, muscle pain, okay. Hives, lethargy, headache and vomiting. We can say allergic reactions. Aseptic meningitis. The veins, yes, you're right. When you have infusions, you have, just getting the IV started. Okay, let's talk about Plaquenil. Headaches. Eye issues. Tiredness. Okay, yes. So eyes, we have eyes, so we're gonna keep that. Okay, cyclosporin. It is a not an it's used, cyclosporin, like Cellcept, is similar, I think, to Cellcept, and it's used, I believe, also. Again, I'm not a professional. I'm going to get this wrong, but we're going to try. It is used to, like Cellcept, help in the rejection for like transplants and things like that. So it's immune suppressant. So who's? You're taking me back to liquid Plaquenil and what we went through there. So I gave you the best example I've got. I don't know that much more. Yeah. Well, we're going to do our unofficial version of first, second, and third line. So first line would be prednisone and methotrexate and maybe Plaquenil. And second line, you would start with IVIG. And I'm not, well, those are supplements. I'm going to say for sure that Cytoxan is third line. Cyclosporin and Cellcept, I think they're more, and rituximab, they're second to third line. I'm going to say 2 to 3. I say Cytoxan is absolutely a third line, and there's tacrolimus, which was not mentioned, which is also absolutely a third line, and Orencia is now being used, and I'm not sure how that's going to play out. But I'm not the physician, so we're just guessing at kind of how this plays out. So most of you may never see some of these medications. I know we have not ever used several of these medications. Let's.
What does cyclosporin replace?
Cyclosporin is an immunosuppressant. So if you were to find that a medication that you're taking is ineffective, then you might try using cyclosporin instead of another medication you're using. It's not a specific, I'm taking this medication and therefore I now take this one, or I don't take this one. It's not that. None of this is that simple. Some physicians will add medications. For example, you might be on prednisone, methotrexate, and IVIG, and possibly even Cellcept or not, I don't know. And they might decide to add a rituximab infusion. So because rituximab is really, it's essentially, it's less often. You do 2 infusions. They're about usually 2 weeks apart, and then you've got a big break. The problem with rituximab, I mean, it works very well, and you're right, there's almost no side effects from getting the infusion. It infuses very much like IVIG, but it wipes out your B cells. So it is it's a powerful medication, but it's very effective. But you do have to watch out for illness with that one, kind of like you do with the other immunosuppressants. So again, with any medications that we take, they could work out really well. Sometimes we have challenges. So I don't want anybody to be frightened because it's been very, very successful for many people. But again, when we're working with powerful drugs, you don't know exactly how your body is going to react to them. Okay, quick, I'm going to skip over Zofran. Rituximab we just talked about. Any other side effects with rituximab? Okay, Cytoxan. Has anybody in here done Cytoxan? Okay, what side effects have? And pretty effective. So please understand, when you do these super strong drugs that have all these really big side effects, they're usually very effective. But it's not. It's like I would say that's fourth line. If you wanted to go down, kind of where that is. I know I said third. Okay, what I want to talk about now is what do you do about this stuff? What are you guys doing to combat some of these things? How do you guys make this easier at home?
Hair loss, we were given Nature's Bounty hair and nail growth because the nails were also breaking off.
Okay.
And
So Nature's Bounty.
Nature's Bounty
It's a vitamin? Okay. So a supplement.
If you use prednisone and plaquenil with methotrexate, it destroys the absorption of vitamin A and D. So if you're a normal milk drinker, it's great, but it destroys it at the same time. So you have to supplement it with A and D.
So supplementing A and D. Okay. So we got some supplements we need to include. Any other ways that you guys combat side effects?
When my daughter was on the methotrexate injections, we would just try to stay ahead of it as much as possible. So she would take Zofran and Tylenol and all of these preventative things before she even got the injection because of the headache. For her, it would be headache, and then that would lead to the nausea. So
Okay.
if we could stay ahead of it and load her up with all this stuff before she even got the methotrexate, then sometimes we could sort of eke through. But if we were unsuccessful and it started to get a foothold, then it would just be over for a couple days.
Yeah. So staying ahead of it with treating side effects. Yes, Doreen?
About anybody else's children, but the alcohol swab, I think, is the worst.
Yes.
Methotrexate, and I think she gets more on that than getting a shot. And I mean, she can't even stand the smell of alcohol in general. Like if you get cut. So
How many people's kids cannot tolerate the smell of alcohol?
and I think that almost makes her nauseous.
Oh, it does.
Smelling candle and put it under her nose.
My kid. So don't use alcohol. You don't need. There's other options. Yes. Yes. Exactly. Could you say that again? Oh, stenexamine. And there's something else that starts with a B that they use. Benadine. That they use at the hospital instead of the alcohol, because so many of the kids now react. Like if you go to the infusion centers, they're not using alcohol anymore for the same reason. Okay. We use hydrogen peroxide, which you can get at, just get it at whatever store you're at. So there's wisdom in trying. You need to accomplish what has been prescribed because your child needs that. But there's wisdom in trying to figure out a way to make that happen that works for your child, for your teenager.
One of the things that they use with my daughter seems to be alcohol issue. They have a freezing spray that comes compressed in the
Yes, the freezy spray and.
freezes the arm until it's numb, and then they slide it.
So there's numbing spray, there's numbing ointment or lotion or cream. I guess cream is the word for it. And then there's like this Buzzy Bee something. And some people hold ice on it ahead of time so that you don't feel it. So there's all kinds of different reactions. My son, we did the numbing cream. And the entire time the numbing cream was on him, he was panicking because he knew the shot was coming. So for us, it was easier just to come get him with the shot. One strategy we used, my guy was maybe 7 or 8. I told him if he hurried up and fell asleep, then he could sleep through the shot. And he did everything he could to fall asleep when he was younger to make sure that he wouldn't have to feel the shot. And he actually slept through it. Some kids freak out at the thought that they might be asleep and their mom might come in and give them a shot. So you really have to kind of work that out. There's all kinds of different ideas out there. You kind of have to work out what works best for your teen. How does he do now? Well, I gave it to him last night. And so we're going to talk about this in a little bit on transition. He's capable of giving himself his own shot. We have gotten to that point. He doesn't want to. And in my opinion, he's 14. He doesn't have to. He's going to have to be able to do it when he goes to college. We got some time on that. How does he do with it? They switched us to here's another tip that you guys probably know. The methotrexate with the preservative tends to burn going in. The methotrexate without the preservative does not burn going in. Lately, we've been using the methotrexate with the preservative. And I'm telling you, what everybody has always said is correct. It does burn going in. So he's a little more unhappy about his methotrexate shot now, but he's 14, so he deals. It says it right on the vial. Neither one needs to typically be refrigerated. We actually my pharmacy called the manufacturer. We were initially told to refrigerate it, but once we had the pharmacist call the manufacturer, the vial, those larger vials, lasted exactly 28 days. I usually pushed it. I think I needed 29 to get in 5 injections out of it, and I figured the difference between 28, that 5th injection, I would just go for it. But with the preservative-free ones, there really are one use only. They don't have a preservative in there. Some people use them more times and have been successful with it, but I would not recommend doing that. I convinced the pharmacy that they initially sent me home with 2 for 4 injections, and I said I need 4. And they came through it because that's what the bottle says. We have gone way over. We've gone way over our time on this topic, but you guys seem to. Go ahead. No, it's usually a single dose jar, because if it's a multi-dose jar, then you'd be throwing away a lot of doses. This way, you're only throwing away, like mine comes with 2 milliliters and my son takes 1. So we're only throwing away 1 milliliter, but I'm not sure you get the second milliliter out fully in a syringe anyway. Okay, we're going to switch topics, and I'm going to write, and Jenny's going to. Okay, did we cover this, or would you like to?
Go ahead.
Okay. Strategies for med refusal. So I have a 13-year-old. So when she was young, it was easy. As they get older, I feel like it's been harder. I'm sure that changes for kids. So what are some, like for a kid, you give stickers, or, there are all these ways you can make them get motivated. Does anyone have any great motivations to get your kids to take medicine and or put on sunscreen? And I have one for sunscreen, which kind of works. We found the powder sunscreen, and you know what? I should have brought it with me, but it just brushes on, and it's like it's just like a container, and she just brushes it on her face. Now, my child's not as sun sensitive as some, so, and she's in remission, and so not on methotrexate. I wouldn't have used that on methotrexate, but it does a decent job of keeping her face covered. And yes, it's expensive. I mean, yeah, yeah, yeah. Yes, that's it. That's exactly it. Okay, and it's Color Science, right? The powdered sunscreen. Okay, and I'm just kind of repeating it for the. Yeah. You know, another hint is, I think it's harder when you have littler kids, but with older kids, shop in October for the next summer because it's way cheaper. We were going somewhere beachy in October, and I'm like, I mean, the prices were amazing, like 50% off. So shop, I felt like when my kid was 2, I couldn't do that, but with an older kid, maybe you can shop on off season to get the clothes a little discount. So, one of the other things we've done is I always wear a rash guard wherever we go. And my boys do too. And so now my little girl's just 13, and now all of a sudden we want bikinis. So I'm not, this is like new. But so I'm sure my rash guard, she doesn't care about anymore. But for a while that helped, like, because and even my husband, I'm like, you're getting one. Everyone's getting one. And so she wasn't alone. And I know you've been patiently waiting.
Yes. So is there my son is biracial.
Okay.
So a lot of the sunscreen that's recommended turns him white.
Okay.
And that's,
that's bothersome.
Yes.
Of course.
So is there some out
Is there titanium, and you don't have to have that with some of
Okay.
This one does not have
my daughter's
lingerie white.
Yeah. He's like, Mom, I'm not white.
Yeah.
Yeah.
Right.
This one goes on clear.
Yeah. And then the kids at school are like,
Yeah.
Right.
No, you're not the first person to ask this question. Unfortunately, I'm not an expert in that because that's not. We have lots of other. But this will go on clear, and there are others. And this is one of these questions that I don't know if we have anybody in the room. Does anybody else in the room have darker skin where this is other brands? There are other brands. So I don't know if you're ever in the JM Moms group on Facebook, but that's a great question to ask because people have answers. I've seen the answers, I just don't have them memorized. Okay, there are answers out there for that.
And I think, and now he's a boy, so I'm brushing powder on his face probably is not a go. But I know they do have that Color Science can come tinted.
Okay.
So, but I can see how you might be like, yeah, I'm not doing that, Mom.
Yeah.
What bathing suit with a Neutrogena.
Oh, spray the bathing suit?
In addition to putting it on.
Yeah, that's a good idea.
So I'm trying to
Yeah, yeah.
get help in some way.
Okay, and did we have anything for like actual medicine refusal? I know a lot of times sunscreen to me seems like one of the harder ones, but sometimes even meds, taking your medicine.
I know she's.
Right. But
I
framing
There's
the
also
conversation.
There's the really hard version. Sometimes your kids say, I'm not taking that, and they refuse to take it, and they're 9, or they're 12, and they need to take that medicine, and they're not 16, they are not old enough to take on that. And I have looked at my kids and I said, well, then we're going to pile in, we're going to go to the doctor's office, and they're going to inject it. So you can either take it now, and we can be done with it, and you can go have a great day, or we can go spend the next couple hours in the waiting room while I convince them that they need to give you your meds. And so there are ways to do these things and to play hardball with our kids when we have to, but you really need to decide, am I playing hardball today, or am I going to try and get them to do it, make the decision of their own accord, because any decision they make of their own accord is a better decision than when you have to play hardball. But you always have to keep in that back pocket, you've got hardball, because this is their lives that we're talking about. This is not a smaller thing.
I just noticed that when she turned 15, this older person came up questioning everything and not wanting to take it. Like, where was this all years ago?
That is part of the transition from being part of mom and family and doing what mom and family tell me and I do and being part of that world, and then being an independent person and making your own decisions.
And you want to encourage
it's normal.
that. It's a normal thing. You want to encourage it.
It's normal, but it's really, really hard, but it's very normal. Do you want to move on to transition?
We've got 30 minutes.
We need to
Just
move on. Let's move on. Okay, we're going to go on to transition real quick because you guys have already touched on transition. So there are pieces as we go into transition and as our kids get older where they need to take more and more responsibility for their medical care for themselves. So when they're younger, and even when they're first diagnosed, we kind of do it all. Like even when your daughter was 16, you kind of did it all because there's a major shocker going on in your family, and your daughter is trying to figure out, our kids, not just, are trying to figure out kind of what our path is. But then as they start to have been diagnosed for a while, or as they start to get older, they need to become more and more responsible. So what are some things that you have done, and I love your examples, to teach your kids to take responsibility for themselves? And I'll just real quick throw out, I've done a couple. My kid, my JMer, takes, I'm embarrassed to admit this, 35 pills every day. So he can look at each and every one of his pills. He can tell you what that pill is and what it does. So he is aware of what he's putting into his body and why. Now, at the same time, he does not always choose. He can give himself his methotrexate injection. He does not always choose to give himself his methotrexate injection. There are pieces our kids need to start doing in terms of talking with the physicians and other things. So I want you guys to throw out more ideas as to what our kids and what we can be doing to encourage our kids to take responsibility for themselves, because at some point they're going to be your son's age and they're going to be out. Yes.
16, that they should have like a little blurb. So when they're transitioning from their peds rheumatologist to their regular one, which we have not done yet, to an adult rheumatologist, they should be able to say, I have juvenile dermatomyositis, you know how this affects her, I'm on so-and-so medications, even like with the teachers in the school.
Yes.
Because sometimes they don't follow their 504 maybe correctly, so that they can be able to advocate basically for themselves, because we're not there with them all the time. So even if it's, you know, a few sentences about what they have so that they could explain it would help out when the mother can't always be there to speak.
So your
for them.
daughter carries something with her that has, oh, she just has it memorized. She's memorized it. Okay.
Maybe she didn't take one, it's stuck in the thing, and she's refilling, and she's like, wait, why do I have, 8 milligrams tacrolimus, and I'm only supposed to have 7? So she knows. She doesn't just take what's in there. If I feel it, or she feels it, or my husband feels it, she knows exactly what she has, and,
yes.
We actually I really trust our doc, and so starting about 16 or 17, he started going by himself. Secretly in this room. She then calls me after he leaves. But it was a good way for me to still feel good, like I knew what was happening, but for him to take over and have to tell them what was going on.
I like that.
Outside of me.
And I think the next step then is like, because Chloe's 23 now, and in the last few years, and it was hard for me to let go of that. And I still would like take her to the appointments, but then it was like, okay, you're going in on your own, you know, and then afterwards get a report from her, and then, you know, no longer getting a report from the doctor, so it's all, you know, she doesn't
I'm
have
not
her
there
own.
yet,
See,
thankfully.
so that's what I was going to say. I don't think my son has been independent since he was 15. He's done so much of it on his own and he likes his privacy. He likes to do it. He's very responsible. I mean, I really have no complaints. I'll say, did you remember? But I know he did. Yeah. But my problem is I have to transition to a certain extent.
That's a good point.
Because it's really, and I still go, he's 25 and I still go to his doctors. And that's hard, but I don't know if it's right or if it's wrong, but I just feel like, especially like we went through a rough couple of years, that if things go crazy, somebody else has to step in. Like I don't want to let go. Like I want to know what he's up on. He makes all his own decisions. I mean, totally. And he does his own thing. But I do feel like there should be somebody in his life that knows all the medications he's on, all the history, what's going on in his life, just in case something does go crazy, can step in to help.
Michelle, you had mentioned this when we were discussing about how we would do this, that one of the important things for our kiddos is that power of attorney.
Oh, the power of attorney. Let me talk to you about that. How many of you are familiar with the power of attorney? Wait, let Debbie go first. She was going to talk. Yes.
When your child turns 18, because of the new HIPAA laws, you are actually not legally allowed to find out anything. So like when your doctor would call you afterwards, when your kid turns 18, they're not allowed to do that anymore.
Yeah.
So there are forms that you can get that you have to have signed that tells the doctors that when your kid is over 18 that they are allowed to discuss your kid's condition with you. Because just being their parent does not automatically grant you that right.
Also with insurance too.
Yeah.
Once
So what-
they
when
won't
you-
discuss it with you.
Yeah,
The
you have to
insurance
get the forms
companies-
and you have to fill them out ahead of time.
So when your child turns 18, there's something called a power of attorney. You can often download those forms off of a state website. And the powers of attorney will cover multiple areas. There are financial, there's educational, and there's obviously health. And there's probably a step further, although I haven't really checked into it, but that would include behavioral health. I think you can probably have medical health, but I don't want to divide medical from health, behavioral, but whatever. There's mental health, and then your JM. So what I recommend is when your child turns 18, download the forms, ask your child to sign. They can rescind that power of attorney at any time. That power of attorney is completely in your child's hands. It is not something that you can ever hold over them because they can rescind it. So what you would then do is provide that to any physicians. I've had a friend who her daughter was in the emergency room and she called the hospital and they would not tell her whether her daughter was there or not. And she finally faxed over the power of attorney and then she called again and they said, yes, she's here. So there are times when you don't get information when your kids are in college because it's their private matter and the hospital does not have to tell you if your 18 or 20-year-old child is in the hospital. So there is wisdom in getting these. If you have 504 plans and IEP plans for your kids, and we'll discuss some of this in the next session, but you also might want to get that power of attorney for your child because that way you can still participate in the IEP meetings as a voting member and you still kind of have significant control over what's going on with that if your student is not ready to take that on because that can be hard for parents, let alone for our kids to manage. Yeah,
A lot of times make her own doctor's appointments.
That's excellent.
Because she checks with me what my schedule is, and then based on her work schedule or her school schedule, then she calls the doctor and makes her an appointment. I also make her responsible for knowing what her med situation is and calling in her own refills. Now, of course, I go back behind her on that, but
yes, no, that's
how
excellent.
she's got.
So making, yes. That's excellent.
One big transition thing that I'm going through, and I think it's probably later than most people are, is benefits. And my
Yes.
HSA from a really good benefit plan. And I actually, I work in IT, and I actually work with benefits people. So I've actually been talking. They actually have people that you can meet with, and they'll basically give you the pros and the cons. Like, I could possibly take Cobra on my old plan for 3 years, or, you know, so like there's decisions you have to make, but it's definitely a transition thing. And it's kind of scary. Because, you know, like I said, I've had him under great benefits, he's under our benefits, and now he's in a year going to go to another plan, and it's a transition thing. It definitely is something you want to think about.
One more thing about transition. Oh, go ahead. They don't have to. They can, but they don't have to. You can keep them on your insurance until they're 26. You can do that. One more thing I want to mention on the topic of transition. There's a website called transition.org. I believe we will all learn more about this tomorrow. But Dr. White over at GW has put in significant effort into making that website happen. And there's lots of great ideas of things to do on that website. They have different checklists. Yes and no. Some pediatric rheumatologists say it's time to go, and some will keep you through college. And once you graduate college, it's time to go. It really depends on the doctor you're seeing.
Had recommended, and we went to that because he's up in Massachusetts now. They actually specialize in taking kids from juvenile rheumatological disorders into adulthood, because juvenile dermatomyositis has different aspects to it than adult dermatomyositis. And it's kind of like, so it actually is a specialty thing almost. And I think that's starting to become more and more a thing where they go, the adult ones will deal with kids that have had these diseases from young ages. So
is that a clinic or is that a specific doctor?
It's actually a clinic, but Dr. Nekrovich is the head of the clinic. He's very good. And, you know, Dr. Curiel, that was it, Dr. Ryan, Dr. Curiel.
Dr. Curiel is at GW. He just made the recommendation.
Yeah, my daughter went from Long Island, but she's in Seattle at school. And we used to live in Seattle. She used to see a pediatric rheumatologist out there. We contacted her to see if she can go back to her, and she said, you know what? Now that she's 18, she's in college, she should go to an adult rheumatologist. So she's out there seeing an adult rheumatologist. She's home for the summer, and we're back at her pediatric rheumatologist in the Bronx. So she's kind of at both, and they're passing on the information back and forth. But
that's a good transition then.
Yeah. For what it's worth, our doc talked to my son and said staying with a pediatric rheumatologist as long as possible, because just by nature of its juvenile onset and that pediatrics gets more time with patients, just as a general rule of thumb, adults have shorter appointment times. And I'm sure everybody has a different experience, so we're really fortunate that Riley Children's Hospital will hold on to him through college.
Nice. Great. Do you want to move on to second opinions?
Okay. So, and I'll be real quick here. So one of the things we want to talk about is second opinions. And basically, one, I think sometimes there's a little bit of a fear to get a second opinion. You know, it's kind of intimidating. Maybe you've got a new disease. Maybe you've been in it for a while. Maybe you like your doctor. You don't want to hurt their feelings. If your child's being treated and you're not seeing a lot of progress, for me, that would definitely be one of the key things to go, maybe I need a second opinion. I don't think it ever hurts. We had a second opinion just because we moved. So we moved from one state. So we ended up with another rheumatologist. And it was good information. We ended up really loving our rheumatologist where we came from. So we go back to that original rheumatologist. And when we left, we didn't, we have a doctor in the family and just said, don't burn any bridges. And so we didn't, because my husband really was commuting back to that state. So we just said, hey, we just really, it helps her go see her friends. We're just going to stay with where we were. So I think there are ways to get second opinions that you don't have to burn your bridge of the other doctor. But it's really helpful because, someone else, a new set of eyes looking at your child. And again, this is just my personal opinion, but if I had my kid had a really complicated case, I would be going to one of the experts. And I say this just because we did see different rheumatologists, and we fly back to our rheumatologist. We love him. She was his fourth patient. That's it. I mean, that's just not a lot of patients to treat. And whereas, the experts have treated so many. So again, this is my personal opinion, if I had a really complicated case, I would definitely think about trying to figure out how to go to Chicago or go to the NIH or GW or just another facility to get an opinion. Yes.
Well, we are a newly diagnosed family, and we got 3 opinions.
Yeah.
We are from Maine, and so our doctor obviously hadn't had a lot of experience, and so we immediately got a referral down to Boston Children's. We love Dr. Dadioglu there. She was responding really well. I don't know that my daughter was an extreme difficult case, but we also talked her to Shannon, who gave us the recommendation to see Dr. Ryder. And we just felt like, hey, if we can go see someone who, knows a lot more, then let's do that. And we had the conversation with Dr. Dadioglu, and she was not offended by it at all. And we did, explain to her, and she goes, I work with Dr. Ryder. We have several patients that we, work on their protocol together. I'm not offended. Go ahead. I would love to hear what she has to say. So, we're new to this, and we did 3, and I don't feel like we need to go anywhere else now since we did go to see Dr. Ryder, but I highly recommend going and seeing everyone that you possibly can. Because there were some suggestions that were made that Dr. Dadioglu has adapted, and I think my daughter's doing a little bit better because she got another set of eyes who knows a lot and tweaked her medications.
And I don't. Our doctor in Phoenix too. We ended up getting to go see Dr. Ryder through a study, and when he found out, he said, that's great." It was. He was very happy, and he actually was very happy to work with the other doctors. Every place is different, and every person, doctors are human, so every person is different. But
with Dr. Ryder and Dr. Curiel. And when he got adults, we had a rheumatologist up in Pittsfield, which was where he was living. And Dr. Curiel got very angry at him because he wasn't, I don't know what was going on, but basically he says you only have one rheumatologist, either here or, and my son said, oh my God, he was called him salty, I think. He was very salty, Mom. But basically now he drives 2 hours to Boston, and that other doctor. I mean, if the doctor is not willing to take advice from another doctor, I don't think you really want a doctor.
I was just going to say, you really do. Yeah, it was really, like I said, but you do have both reactions. I was kind of surprised and taken back by it, but you do.
I have to admit, I'm not a physician, I'm a physical therapist, but as a health professional, I would have to say, if your physician is offended by the fact that you want a second opinion or some additional input, you got to question why you're going to see that physician, because I'm never offended if somebody, I talk to my colleagues about my clients, because sometimes you might miss a detail that somebody else picks up on because it's a different set of eyes and they see it from a different perspective. I mean, we have weekly meetings where we discuss our clients and make sure that we're always on the right track. So if your physician is giving you a hard time about about seeing someone else, I would really question whether or not you want to be seeing that physician, because that physician is going to say, well, this is what I think and that's it. There's no other possibility.
It does
well,
happen.
maybe there is another possibility. And yes, it does happen. And
well, I think we all know this is a rare disease, right? We're not talking about getting us 3 opinions on the flu. This is a rare disease, and all these kids are a little bit different. And so getting these extra opinions, if you can, it's not always so easy, right? But if you can do it, to me, it's worth the time and energy, if you can. And Michelle has a lot. I think, are they going to talk about that later?
I want to just broach, I'm sure this will come up later, but I just want to make sure you guys understand that there's, here in the DC area, there's 2 options for coming here for expert opinions. One is if your child qualifies for the twin sibling study at NIH. It sounds like most of you, we've had diagnoses longer than 5 years, so that kind of rules you out right there. But you would have to have a same gender full sibling who is within 5 years of age, and your diagnosis date would have to be less than 5 years from when you go to see Dr. Ryder at NIH, and then you might qualify for that study. There's a few other pieces, so that's always an option. And then if your child is 7 or over, and all of yours are, you are welcome to come to GW And basically for that, we do need the cooperation of your rheumatologist because it's a consultation clinic. They don't actually practice for children. But if you want to bring, and a number, I recognize so many of you because you have come, but if you wanted to come to GW, then you just would need to bring a very informal referral. We would like to have your physician's cell phone number and all your records, and then you'll get an expert review of your child's case.
Where he is, what he's from.
So Dr. Lisa Ryder, she is one of the experts in the disease in juvenile myositis. There are several experts. We had CureJM has several centers of excellence, and I of course am speaking of GW because I have volunteered some time and then worked there very, very, very part-time as well. But there are centers of excellence at GW here. There's one in Chicago. And there is another one that I think is just in the midst of launching in Seattle. So there are 3 options for CureJM centers of excellence.
I would just say my daughter was in that study in NIH with Chloe with 8, and it was an amazing experience.
It is an amazing experience.
Body scanned by the latest and greatest equipment. Yeah, I would highly recommend it. You may, I don't know if you qualify, your new diagnosis.
She already went to Dr. Ryder.
Did she, the siblings?
She didn't call you.
There are times when there are differences of opinion, even with the best of doctors. And so you should always not be shy to check out somebody else if you are unhappy. If there's a personality clash with someone, don't be shy to find someone else, to go someplace else, because sometimes it does not have anything to do with the doctor's expertise. It has something to do with the fact that your kid and this doctor, their personalities are just not, there are people in this world that we don't enjoy. And when you're talking something as personal and kind of fear causing as being sick, you really need that right personality to work with you.
We had a great relationship, and my daughter loved her and the whole bit. But she didn't want to be questioned.
Yeah, Jenny's going to close. Go ahead, because I think.
Okay. So we, before we leave, we wanted to talk about silver linings or hope. And maybe if we could each share a little silver lining or a little hope that through this disease. And so, kind of there were 2 things I wanted to share. One was, my kiddo was sick at 7, and so she didn't play. She read all the time. Well, she's a fantastic reader, a fantastic tester now. So, would we have had that if we didn't have JM? I don't know. But so that's our little silver lining is the kid can, score off the charts on these tests because she spent so much time in her bed reading. And so, maybe there's a silver lining you can think of. And if people would like to share that. So we kind of leave the room in silver lining or hope. And the other hope little piece was, I forgot to bring it, but in the midst of a teenager in medicine, and it can be so difficult, I keep a little note my daughter wrote to me. And it just, because to me, it's sweet and it's kind and it's beautiful, and that's who she is. She's not the kid that comes out roaring at me. She's really this really sweet kid. And so I keep the physical note and I and kind of take a step away and go, okay, this is really her. Let's figure out what the mess I'm seeing in front of me really is. So if anyone would like to share, we thought it would be a nice way to kind of leave this session. Okay.
When my daughter was diagnosed, we had a long time to try and find the right treatment, and she was inpatient for about 2 months, and then rehabilitation because she was pretty debilitated. Her team at her hospital introduced her to aquatherapy, and through aquatherapy, she is at the top of her game. She's on a competitive swim team, and she would never know she was sick. So she has found a love for swim, and she swims 5 days a week and competes. And that was all introduced to her by her
physical therapist, occupational therapist, and aqua therapy.
Wow, that's great.
Yeah.
Well, my daughter was in the same position. She had a TF7 dog. And they said you can stay in Dana Harbor, cancer kids. She was paralyzed from the neck down. She could hardly speak. And she had lost all her hair. So they told her, you have to stay here. She was in there for 3 months already. And so they find a cure. And she said, no, wait. Mommy told me God made me, and I have a life to live. So I don't care what you say, I'm going out to live my life. And with that, they gave her all the medications and what she has to do. She said, I'll do it. And she went out, now she's an honor student in the Music Honor Society. She's a complete athlete with everything. And she says, I'll make sure that I will do this.
My daughter's going into nursing because of it, because she started at 10 and spending all her time with the nurses and the compassion, and so she's in her 2nd year of nursing school and doing awesome, and she's got all the compassion and caring that, I think it made her who she is. Yeah, yeah, she became really, not strong, but she's just got something. I look at her and I'm amazed. I cry and she's like, Mom, it's okay, and she's amazing. She really is. So I think it made her who she is. Yeah.
Last year, I'm sorry. Last year I got to see the student panel, or the youth panel and the young adults, and I was actually amazed, and Parrish included, that out of those 10 kiddos or young adults sitting up there, 8 of them were looking at the field of medicine, or in the field of medicine.
Mm-hmm.
I just thought that was really powerful, the impact that they'll go on and have. So
I think Chloe always became an expert on reading doctors. I mean, I will take her assessment of like, is this a good doctor or not? It's like, yeah, she's got that. Her dad and I are both nurses, and so I thought maybe with that, maybe she'll go into that. Absolutely not, nothing to do with medicine. But she's going to go into social work, and she has that compassion and caring. And she went to the Camp JRA, Camp Victory in Pennsylvania and she started going there when she was 9, all the way through high school, and that was just a very important, experience for her. And now she gives back, and now her sister, her sister, who's 2 years younger, who grew up with it as a sibling, and now the 2 of them are going and are camp counselors there, and giving back to that, and just seeing the caring person that she is. And again, I think a lot of it has to do with, what they've been through.
I just had a story about how great some other people could be, because all of our kids live a very different life than most kids. And I know, like, James wrote this great poem about being discriminated against, basically. And so there was this great story that just happened to my daughter at the end of school. She has her friends, her little crew of 10. They were having a big sleepover, and the morning before the sleepover, I get an email from the father, hey, it's going to be 85 degrees and sunny. I thought it'd be great if we take the kids out tubing in the boat. And my heart sank, and I went, no, she can't. Her numbers had she started to flare, and I was like, and then the doctor called and said, yeah, no, she can't do that. And so I emailed the parents, and I said, that's great. Don't know if you heard, my kid has this disease, and she cannot be in the sun, so what time will you be back? And we'll bring her over when you're back from tubing. They emailed me back, and they said, change of plans, we like activities that everybody can do. And then they emailed all of the other parents and said that the reason that they weren't going tubing was because they couldn't find the insurance on the boat because it was brand new. So there are some good people out there who, they wanted to spare her feelings. They were cognizant that this could be an issue, and they accommodated her without even being asked.
Wow. Yeah, that's really nice.
Yes, that's what a great story. Would anyone else like to share? Why? Oh, yes.
My daughter, she hasn't let it define her, and she's to like the medical field. She's only going into 10th grade, but she already wants to be an IT doctor, IR, which we never heard of, but those ones to put in her 2 ports.
Yeah.
So, and then we, then she'll be in surgery. Now I want to be a pediatric surgeon. So she's 2 will be going into the medical field, I do believe. And she's just, I think, has grown. As terrible as it is, I think she's matured from having this disease, and she doesn't, not that she doesn't, she's an old soul.
Yes,
And
I
she
say that
doesn't
all
get
the
involved
time.
with the petty stuff
Yeah.
that other kids might, because she knows that there's things in life that
Kind
matter
of,
more.
They're forced to grow up, I
Yeah.
think, a little earlier than
Yeah.
others,
Yeah.
but I don't know if they're up for the challenge.
Yeah.
My son amazed me.
Always.
I mean, I'd watch him and he never complained. I mean, I'd be whining with some
Yeah.
of the stuff he went through, and he just did it, you know? And I think all the kids are like that. I think they really do grow up a little earlier, and it builds a stronger character in them. So if there's anything positive, I would have to say that is that they tend to, because of what they've been through. Exactly.
They are really
Exactly.
tough.
I really do believe
What
it
our
makes
kids
them
go through on a daily basis is way more than we would ask most adults to do.
I couldn't do it. They're troopers. They're all troopers. Yeah.
I know my daughter goes through. He's like 2 years ahead of her time.
Well, mother, 2 years ahead of my dad.
I don't know, but they can come up with it.
Thank you guys for sharing. We have a wealth of wisdom in this room, and I think if we add in our kids, they're probably even more wise than we are. So it's really great to listen. Yes, yes. They're probably learning this over there, but for those of you who don't have your tweens or teens here, on the Cure Jam website, there's a teen portal now. So if you want to gently guide your teens and tweens to that part of the website, that's where a lot of kids are connecting to each other and getting resources. A lot of that transition information we talk about is going to be coming to the website as well. So. They can just go and read it, or they can connect. They can do it either way, whatever their comfort level is. But thank you to Michelle and Jennifer for leading us through. And there's snacks outside in the hallway, and then we'll see you in half an hour at 3 o'clock at the next session.